Hi everybody, welcome back to my channel. Today I'm going to be speaking about my surgery where I received a right side thyroid lobectomy. And now I just thought I'd do this video to kind of put anyone's mind at rest who is going to go through with this surgery and just let you know the sort of ins and outs of what to expect on the UK NHS system. I had what is called a diagnostic right side lobectomy, which is where they had to take the lump out to then do further testing on it. On the 5th of June 2015, I had my pre-operative assessment, which is where they ask you questions about your medical history, your family's medical history, things like allergies, things like any other major surgeries or major illnesses that you've had before. On the 26th of June 2015, I went to York District Hospital to have my surgery. And now I'd been fasting since the night before because you're not supposed to eat or drink anything from at least 12 hours before your surgery. So the first meeting of the day was with a nurse, and now she took my heart rate, my blood pressure, and she measured me to get the size of my gown and the size of my compression socks, which are the socks that you wear to make sure that you don't get any blood clots or anything in your legs from long periods of inactivity, such as after a surgery when you're lying in bed. My second meeting of the day was with my surgeon, who was called Dr. Coatsworth. And he explained to me that he would be making an incision in my neck in between my two clavicle bones, which are these collarbones here, and that it would be as low down as possible and as small as possible. During this meeting, you also have a full rundown of the risks associated with your surgery. Risks with a thyroid lobectomy are firstly that they can affect your voice, and you can either have a temporary or permanent hoarse voice, or in some really severe cases you can lose your voice as your voice box runs just behind your thyroid. And my surgeon explained that this happens in less than 1% of cases. The second risk associated is to do with your parathyroid glands, which run alongside your thyroid. And now these are responsible for the calcium uptake in your body, and so these can be affected by surgery. And after your surgery, they do monitor your calcium levels to make sure that everything is in working order and nothing was affected by the surgery. After this, he explained the risks with just going under general anaesthetic as a general whole, things such as infection and problems with bleeding. But again, this is the same across all surgery where you are put to sleep under general anaesthetic. Further to this, I was informed that I would be asleep for roughly 2 to 3 hours while the surgery was taking place. Going back to the actual thyroid organ itself, it is a butterfly-shaped organ running on your throat, and it has 2 lobes, and the isthmus is the middle of your thyroid that connects the left and right lobe. I was told that during my surgery I would keep my isthmus and the left side of the thyroid, and that in 95% of cases people who just have one side of their thyroid can function normally and will not need to have hormone replacement therapy. The final thing that the surgeon did was draw a felt tip line on my neck and an arrow pointing towards where the lump was. My surgeon actually joked that he wouldn't really need to do that because of how big the lump was, but it's just normal procedure to just draw attention to the area that you will be operated on. The next meeting of the day was with the anesthetist, and now this is the person who will be in charge of firstly administering the drug that puts you to sleep, and then all throughout your surgery they monitor you to make sure you are okay and responding well to the drugs and things. So with the anesthetist, again, you talk about your medical history, your family medical history, and any allergies that she needs to be aware of. And so she explained that I would have an IV in my hand and an oxygen mask, and it would sort of feel just like slowly falling asleep, and she'd either count me down or she'd slowly talk me through as I fell asleep. Further to this, she did mention that some people, very few people, actually remember the anaesthetist removing the breathing tube from your throat as you reach consciousness. She said she just had to warn me of that, but it doesn't happen in many cases, but they do just need to warn you of any risks or anything as you wake up. From here, I had a final interview with the head and neck doctor who would be dealing with all of my case after this. So all these discussions with the nurses, the anaesthetist and the doctor and the surgeon all took place over about 2 or 3 hours, and I finally went down for surgery at around 2 o'clock. And you lay down on a hospital bed and you have an IV in your hand, and they just, they're talking with you. That's really, really calm situation. They were actually just talking to me about, they found it funny that my parents had to stay in my student house, and they were just kind of put my mind at rest. And they then put an oxygen mask over my mouth and nose, and the anaesthetist told me she was administering the drug, and you do just slowly feel it goes up your arm, and then you just sort of like a drunken sleep, you just kind of slowly fall asleep. Sounds very odd, and it's very hard to fully convey what it does feel like, but I do just want to put people's minds at rest, because I, going into it, was completely just had such a fear of the unknown. I'd never had surgery, I'd never had a general anaesthetic, and so I was just so apprehensive as what was to happen. But the doctors and nurses really put your mind at rest, and it is just a very calm situation. And I was lucky enough that one of the nurses did hold my hand during everything, and as I fell asleep, I just remember that I was holding her hand, and it was just all very calm. When you wake up from the surgery, you are in a more intensive care recovery room, and now this is where everybody goes after surgery, and you are waited on by sometimes maybe 3 or 4 different nurses and doctors kind of keep an eye on you. When I woke up, I had a nasal cannula which administers oxygen. I had a drain in my chest. I don't know if there's still a scar there, but it basically is just a tube coming out of your chest connecting to a bottle of blood, and that is to monitor how much blood you are losing, and they want to keep it under 40 millilitres of blood over the next subsequent 12 hours or so. As you wake up from general, you feel very nauseous, very dizzy, very just sick and unwell, and I don't really remember too much from the recovery room, but I just remember speaking to all the nurses and just asking if my parents were there and if I can go see my parents, and they're encouraging me to sit up and drink some water, and they just talk to you and make sure you're okay before they then wheel you on into the ward that you'll be staying in that night. I got to see my parents and my boyfriend. Again, I had lots of painkillers and drugs in my system to help with the pain after the surgery, and don't really remember much, but it was just nice to see them. And then I just fell asleep with, I had an IV in my hand administering fluids and painkillers. I had my nasal cannula, I had the drain, I had 8 staples in my throat for around another overnight, and then another kind of 12 hours in the day, and at around 3 o'clock I was allowed to have my drain removed, as the doctor knew that I'd lost less than 40 millilitres of blood, and so I was free to be discharged. So I was discharged with the prescription of 40 milligrams of codeine, which unfortunately I'm actually allergic to, so I ended up taking paracetamol and ibuprofen at 2-hour intervals very strictly over the next couple of weeks. 1 week after this, I had the staples removed at a hospital in London, just up the road from me. And then in 2 weeks after my surgery, I had my follow-up appointment, which is where I got my diagnosis. I really hope that this video and my story helps people who are about to go through any surgery, or even having the thyroidectomy or a right side thyroid lobectomy. I just think that having a little bit of information about it does really help, and I hope I help put people's mind at rest, because it is quite daunting, it is quite scary, especially if it's your first time. But just, if you just let the doctors, like, they know what they're doing, and you just kind of do exactly what they say and remain calm, and you can hold anyone's hand, and it's okay to cry and be upset, but just know that you are in the best hands possible, and it is all going to be okay in the end. Thank you very much for watching my video. Please go on my blog if you'd like to see photos from around the time of my surgery. I can link that down below. Again, thank you very much for everyone for your support. I love hearing your stories, and I love everyone who's behind me, and just thank you very much, and I hope to keep you updated. I have a follow-up appointment tomorrow, so thank you.